I'm Michael Gallagher, Sports Physical Therapist. In our last video, we talked about the knee joint, the anatomy of the knee joint, and pathologies which are common to the knee joint. During this time, when we can't come out of our house, when we can't go to physical therapy to the orthopedist following a knee injury, these videos will try to help us be able to treat our knee joint or knee pain in a home environment with the use of modalities and exercises. In no way should this replace seeing your orthopedic surgeon or seeing your physical therapist, but a way of bridging the gap. So why do we have knee pain? There are many reasons. So the treatments we talk about today are generalized to decrease pain, decrease swelling, decrease inflammation at the joint. First thing we're going to do is evaluate our own knee joint. We're going to look or observe the knee. We're going to look for swelling, discoloration of the knee joint, comparing right to left, seeing if they look the same. Many times when we have swelling, you won't see your kneecap, you won't see your patella. A good way of assessing that on your own is taking your hand, milking or pushing the fluid down into the knee joint, and comparing to the contralateral or the other side to see if there is a difference. You may feel a bogginess or a feeling of fluid around the knee. The other places we spoke about that fluid could accumulate is in the popliteal recess or popliteal fossa, the area behind the knee joint. These are the two primary areas that swelling will sit. The other thing we can consider or think about is not so much swelling, but inflammation, areas of the knee that become irritated or inflamed. That would be at the patella tendon, just below the kneecap, or also at the medial and lateral, the inner and outer patella borders. You may not see swelling or feel a bogginess, but these areas can become inflamed. So how do we treat swelling? How do we treat inflammation and pain? We've all heard the acronym RICE: rest, ice, compression, elevation. All things we can do at home. Rest, simple. Stay off the leg. It hurts, it's irritated. We may not want to go for a run, a long walk, or a bike ride. We may not want to do some gardening where we're on our knees. Ice, very easy. A bag of frozen vegetables upon the knee. We can actually take a bag full of water and ice cubes and place them upon the knee. What you just heard in the background there was actually my ice maker making ice cubes on command. The other thing you want to do is elevate. How do we elevate? Well, we can place a pillow under the knee joint or under the leg to keep it elevated during treatment. A good thing to do is elevate while you're sleeping at night. Difficult to place a pillow under your knee while you're asleep because in the morning that pillow is going to be on the floor. But if we could take that pillow or take a blanket or a textbook that you're not using right now, place it underneath your mattress. Place the mattress on a little bit of a slant. That way, no matter which way you move or turn in the evening, your leg will always be elevated. 6 inches is enough. 6 inches above the heart will help to decrease that swelling in the knee joint. Compression. Best way to compress the knee is either an ACE bandage or some type of neoprene sleeve, just to contain or hold the swelling down, prevent it from swelling even more so. Simple ways of treating your knee joint pain at home or treating your swelling or inflammation. The other thing we want to start to do is maintain the quadriceps muscle tone. The quadriceps are the 4 muscles which sit above the knee. As little as 20 cc's, a small shot glass full of swelling in the knee joint will start to shut down this quadricep muscle, especially the inner muscle called the vastus medialis. 40 cc's of swelling will start to shut down the middle muscle, or the rectus femoris. These muscles work as the normal pump to remove fluid from the knee joint. There's always fluid in our joints. It's called synovial fluid. It's a natural lubricant that the body produces to allow us to move around. It's our body's WD-40. Why do we get swelling? Well, because of an injury, because of an irritation at the joint, the body produces extra synovial fluid, extra lubricant. That lubricant then sits in the knee joint. As we said, extra lubricant will start to shut down the musculature. Normally this muscle is working as a pump. Now your pump's not working efficiently, so we have swelling at the joint. So in a good knee, body produces a fluid, the muscle contracts, the swelling is recirculated, returned to the body. Now, fluid's being produced at a quicker or faster rate because there's an injury to the joint. Because of that fluid, the pump is not working efficiently and we get swelling. So yes, we can use ice, elevation, rest to control the swelling. But the most important thing is getting this muscle pump working again. So the first exercise I like to teach my patients is something called a quadriceps set. We usually use a pillow or something to help give a little proprioceptive feedback. So what I'll do is I'll take a pillow, place it under Michael's knee, and what I'll have him do is tighten or push down to the pillow, bringing the toes up and compressing the pillow, tightening the quadriceps muscle, holding for a count of 5 seconds, and then relaxing. Relax it. Good. Again, pushing down to the pillow, bringing the toes up, compressing the pillow, engaging the quadriceps muscle, initiating that muscle pump. Every time he contracts the muscle, it will help to push or pump the fluid out of the suprapatellar pouch, out of that popliteal space where the fluid is tending or has a tendency of sitting. The next exercise we like to do is what they call an adduction exercise. We'll have Michael bend his knees up. We'll take that same pillow, we'll place it between the knees and have Michael squeeze and hold. Again, engaging the quadriceps, the adductor muscles of the leg, but really concentrating on that vastus medialis, that inside muscle, the first muscle to become weak. When we have swelling, we want to work on that muscle. Again, holding for a count of 5 and relaxing. What I usually suggest is doing sets of 15 repetitions for 5 seconds each, and do it 3 times a day. The easiest way to remember: breakfast, lunch, and dinner. The next exercise I like Michael to do for his quadriceps, if able and if not painful, is a straight leg raise. Keeping the other leg bent to protect his low back, he's going to tighten the muscle, bring his toes up, and lift 6 inches off the table and hold for a count of 5 seconds. 1, 2, 3, 4, 5, and down. These exercises should be done as long as there's no pain. Discomfort, okay. What I tell my patients is grade the pain on a scale of 1 to 10. As long as that pain level doesn't exceed a 4 to a 5, it's okay to work with it. There may be some discomfort, but should never be painful. Beginning steps: knee pain, rest, ice, compression, elevation, engaging the quadriceps and the adductor muscles to help to eliminate swelling. On our next video, we'll talk a little bit more about strengthening the knee joint. Thank you.